How does skin thickness affect a rhinoplasty result? During rhinoplasty, the surgeon primarily reshapes the underlying framework of the nose. After that, the skin has to reshape over that framework. With thin skin, it settles very nicely over the nose, but it can show any minor irregularity. With thicker skin, it's harder to achieve as much refinement, but it also camouflages minor asymmetries or irregularities. Thin skin tends to heal faster with a closer to final result sooner than thicker skin. With patients with thicker skin, it's harder to achieve as much tip refinement as it is with patients with thinner skin. Therefore, in thin skin patients versus thicker skin patients, we may need to balance some of the overall profile of the nose to achieve more refinement in thicker skin patients compared to thinner skin patients. So there's really not a good skin or a bad skin for rhinoplasty. They're just different, like all things in life, right? So if you have thicker skin, it's probably going to be harder to see irregularities, but it's also going to be harder to achieve a lot of refinement. In thinner skin patients, you may have so much refinement that you can see every minor irregularity. So you have to balance that, and the rhinoplasty surgeon should help educate you about this process because there are actually some techniques that you can use in both thin skin and thicker skin patients to minimize the downsides. Think of the skin as a material covering a sculpture. A thin covering shows every detail underneath, while a thicker covering softens all those details. The surgeon reshapes the framework, but the skin determines how clearly that framework is displayed.